Hello, everyone. Welcome. Thank you so much for joining us today on Dementia Challenges in Long-Term Care Settings. I'm Molly French. I direct public health for the Alzheimer's Association. I'll be your moderator together along with John Sheehan, the Associate Director for Public Health with the Alzheimer's Association. With support from the Centers for Disease Control and Prevention, we are really honored to have you join us today, talk about how the COVID-19 crisis is exacerbating many of the unique vulnerabilities related to dementia in long-term care settings, and especially what public health professionals and their agencies can be doing. Please complete the poll on the side of your screen. Tell us about yourself. While we cover a couple housekeeping items, we have muted all lines to eliminate background noise, and we are recording this webinar so that it can be available to others. We've reserved time at the end for this webcast for questions and answers, so please use the Q&A feature again on the side of your screen anytime, but please start loading that up now. And then next week, I will be sending everybody the slide deck and a link to the recording. Because it's a difficult and challenging time for many people personally, professionally, just want to acknowledge that, and especially to thank public health professionals, professionals who've been working in the long-term care settings, in the aging services, and throughout our communities, first responders, for the tremendous and essential work that you've been doing at this time. This webcast is specifically geared for professionals. And if you're dealing with a personal situation or looking for information that's going to help you or your family member, what I'd encourage is for you to be sure to use the Alzheimer's Association free 24/7 helpline. It's staffed by specialists. Just call 800-272-3900 anytime. It's available in multiple languages, and it's not just Alzheimer's. You can learn about and ask questions about any other type of cognitive impairment or cognitive health and dementia issue. Our website is also available, always being updated. alz.org/COVID-19 help is our portal for particularly for consumers and other professionals. Just to give you a quick overview of today, what we're going to be doing during our 30 minutes. First, do ask you to complete a quick reminder to quickly complete that poll on the side of your screen. And then for today, we're going to be, I'll be setting the stage with a little bit of background and facts about long-term care and dementia. And then our CDC experts are going to be joining us so that we can talk about how the COVID-19 pandemic is creating special challenges for people living with dementia and caregivers in long-term care settings. And then what public health professionals can be doing to tailor their response to COVID to better protect the health and safety of people living with dementia and their caregivers. Please use the Q&A feature at any time. And again, we're saving some time at the end of the webcast for questions and comments. Anything that we don't get to, we will respond to in the next few days if it's related to dementia. So again, if you're just joining us, I'm Molly French with the Alzheimer's Association, and we are so delighted and honored to have two CDC experts with us today, both from the Alzheimer's Disease and Healthy Aging Program. First is Dr. Lisa McGuire, who leads the Alzheimer's Disease Healthy Aging Program. She has published over 100 articles, is a member of the National Alzheimer's Project Act Federal Advisory Council, and provides leadership on many other boards and national initiatives. We also have Dr. Nia Reed. She's an ORISE Fellow, again at CDC, and she completed her master's in gerontology and her PhD in sociology. My colleague from the Alzheimer's Association is John Sheehan, who will be helping me host. Because this is the first time that some public health professionals may be thinking about Alzheimer's and dementia in terms of emergency response, I'm going to just quickly give a little quick level setting. So what do we mean by dementia, and how does it relate to Alzheimer's? Think of dementia as a set of symptoms that are characterized by the loss of cognitive functioning that's severe enough to interfere with daily life. And dementia is not normal aging, but you should be thinking about it in terms of similar to other chronic conditions. Dementia tends to be developed often later in life, but there is younger onset for a small population. Several diseases and conditions cause dementia. Among them, Alzheimer's disease is the most common cause. And for Alzheimer's disease, it is an irreversible progressive brain disease. It slowly destroys memory and thinking skills, and eventually the ability to carry out some of the simplest of tasks like movement, being able to feed yourself. The second most common cause of dementia is vascular dementia, and this is a decline in thinking skills caused by conditions that block or reduce blood flow to the brain, such as a stroke. You see here some of the other types of dementia, causes of dementia: Lewy body, frontotemporal, Huntington's disease, Parkinson's disease, dementia, and others. Increasingly, we are learning from research that there are many cases of mixed dementia in which a person has multiple causes of dementia. As dementia progresses, people with condition rely more and more on caregivers. And from the behavioral risk factor surveillance system, we know that 1/3 of caregivers for people living with dementia actually are providing at least 20 hours of care per week, and many of them have been providing that care for at least 2 years. So it gives you a sense of the scope and the amount of commitment these caregivers are providing. And because we know that caregivers are really what make a difference in terms of whether a person living with dementia is in home or community setting versus needing long-term care, it's very important to be thinking about the caregiver's own health and well-being too. And again, from the BRFSS, we know that they are under a lot of strain because caregivers for people living with dementia are 79% more likely to report spending at least having 2 weeks or more in the last month in poor mental health compared to non-caregivers. Again, the special unique vulnerabilities of people living with dementia and their reliance on caregivers mean that the COVID-19 crisis, as well as other emergencies and disasters, can be a particularly vulnerable time for people living with dementia and caregivers, even when those people with dementia are in long-term care settings. And because of this, and some of these unique challenges, the Healthy Brain Initiative roadmap for state and local public health agencies and their partners, you see a picture here, calls on public health in their emergency response to be making sure that people living with Alzheimer's and dementia, caregivers and others affected, are receiving the information that they need, and that emergency response professionals are prepared, know about people living with dementia and their vulnerabilities and how to be effectively addressing the situation. And now just a word about long-term care settings. I read every day in the Washington Post. I'm sure it's well covered in your news outlets and even in our own communities. We've seen that COVID-19 has just had an excessive impact on long-term care residents and staff. And there's a lot of factors at play, just the circumstances. Living in close proximity, many of the residents are in poor health. That's why they're in a long-term care setting. At the Alzheimer's Association, we also know that our nation just has not done enough to make sure that these facilities have the personal protective equipment, disinfecting and other supplies, testing skilled staff. So one of the highest priorities for the association now is partnering with others to quickly turn around the situation and put in place the long-term improvements that are needed. And we really want and see a need for public health to be part of this solution. To give you a little context, nearly half of nursing home residents actually are people living with dementia, and they comprise a large percentage of residents in residential care facilities, including assisted living communities. In the severe stage of dementia, people often become bedbound and need round-the-clock care, and that's something that a lot of family and friends have trouble providing over multiple years, which is why they're so reliant and grateful to have long-term care settings available. We also know just in ordinary times that many long-term care workers and professionals lack training in providing quality dementia care. Prior to COVID-19, people living with dementia in long-term care settings, of course, they had the workers there, but they were also getting help from family, friends, and unpaid caregivers who'd come in and provide assistance. Of course, with no visitor policies, that support has gone away. And then also during COVID-19, long-term care residents with dementia may be more isolated due to appropriate practices, trying to protect the community, but then that means that they're not necessarily always receiving sufficient support or cueing, practice safety behaviors like hand washing or being prompted to continue eating, drinking, or even recognizing which items are edible and which are not. So now that I've given you a little bit of background about some of the challenges for people living with dementia and caregivers, particularly when it comes to long-term care settings, I'd like to invite our guests, Dr. McGuire and Dr. Reed, talk with us about what public health professionals should be thinking about and doing with regards to Alzheimer's and other dementias. And Dr. McGuire and Dr. Reed, are you on the line now?
Yes. Hi, this is Dr. Reed. I am on the line.
Right, and I heard you too, Dr. McGuire. Thank you so much. And Dr. Reed, I thought we'd start with you. You've been serving, and thank you for your service in the Emergency Operations Center for CDC. And I wondered what CDC is hearing about how COVID-19 and the circumstances of the pandemic are creating for people living with dementia in long-term care facilities.
Thank you, Ms. French, for that great overview and for that great introduction. At CDC, we've learned that staff and administration at long-term care facilities are facing difficulties keeping people living with dementia safe for a number of reasons. And here are several of them. People living with dementia in long-term care facilities might be at increased risk because they are exposed to multiple staff members, whereas people living with dementia in community settings in their homes may only be exposed to one or two people, perhaps just their caregiver. Cognitive challenges include more than memory problems, as we all know, so there could be some other difficulties like behavioral issues. Long-term care facility staff members may have difficulty caring for people living with dementia because, one, they may not cooperate with care and may not follow personal protective measures, such as wearing a cloth face covering or practicing social distancing, or two, they may refuse diagnostic procedures. However, there are ways that long-term care facilities can mitigate the spread of COVID-19 and keep residents safe, and that includes everything from reducing facility risks, like canceling elective procedures or canceling visitation for non-emergency caregivers, isolating symptomatic residents from other residents, and protecting the staff by making sure that they have the proper protective equipment as well as the residents.
Thank you so much, Dr. Reed. You really kind of helped fills out some of that. Dr. McGuire, what do you see as some of the foremost challenges in terms of minimizing risk, helping keep those long-term care residents living with dementia, as healthy and safe as possible?
Well, thank you very much for that question. So when we're talking about residents who are in a long-term care facility who have dementia, some of the things that we need to think about is the majority of those who do have dementia probably have another chronic health condition. So it's not just as simple as managing that the condition of dementia, but at the same time, as Ms. Reed or Dr. Reed pointed out, there are multiple care staff that person with dementia is interfacing with. The people who might be bringing them meals, the person who's providing their medications, the person that's helping them get dressed or showered, and these types of interactions occur, 24 hours a day. So the things that we need to think about is that that's not just a person who has dementia, but they have other health conditions that need to be monitored and to be managed as well too. Other things that we need to think about are some of the characteristics of the disease of dementia. So many people who have dementia wander, which means that they want to walk around or want to move, and that has a direct impact on their ability to social distance, as does their cognitive or their memory challenges. So when we're talking about dementia, it's not just memory loss that the person is having, but they're also having challenges potentially with thinking, reasoning, and judgment. So simple things like stay away from other people may be very easily forgotten, or the wandering habits and routines will take over and make that almost impossible. Other things, the same thing too with wash your hands. So in other words, it may be something where someone has to be cued, needs to have demonstrations repeatedly, or someone might need to watch or witness that they actually are carrying through that task. Other things to think about with dementia too is some folks with dementia are not able to express their thoughts, their feelings, and emotions the same ways that we do. And those may manifest in anger or frustration or even maybe refusals to do certain types of things. So we need to keep in mind and also keep an eye on the behavior of that person, because if it's changing drastically in this time period where they might be isolated from their family and their friends who might have been providing support, we need to be aware of that, because we do know that depression and that loneliness may manifest differently in a person who does have dementia. The last thing that I want to mention with the challenges too, Ms. French at the very beginning mentioned how important caregivers become through the progression of the disease process for people who have dementia. And we do know, even though a person is residing in a long-term care facility or even in a memory unit at a long-term care facility, many times those family and friends really serve a key role for helping that person maintain their independence as much as possible. Many times they may help them with their eating. I mean, I know of many different situations where a spouse or a family member comes in for each meal to encourage and prompt their loved one to eat. And without that support that can take a very, very long time, they're very concerned that their loved one may not be eating as well or maintaining their nutrition, or as well as keeping up their own personal hygiene. So I know, we are, not allowing non-essential or health-related visitors to come into long-term care facilities because we are trying to protect the population that's so incredibly vulnerable. But we also have to keep in mind too that some of that support is missing. And so sometimes, family members who place their loved one in a long-term care facility have some guilt about that. But right now, what I'm hearing a lot of is there's a lot more guilt. because they don't necessarily know how well mom or dad's being taken care of, or are they eating? So we are seeing some, even from the caregivers on the outside world, some extended guilt as well too. And I think it's important as people who are working in long-term care facilities to recognize that when caregivers might be a little short or snippy as well too. So back to you, Ms. French.
Thank you, Dr. McGuire. And, just you raised so many excellent points, and, in terms of the prevalence of the comorbidities and the need to be trying to manage and monitor a lot of wide variety of other chronic health conditions, addressed the behavioral and the caregiver aspects. So really appreciate that. One piece is that you mentioned is just that people living with dementia, may be manifesting just because they are having trouble at a moderate or severe stage of Alzheimer's. Communication declines, functioning declines, but so they may manifest their isolation or their loneliness, a different construct, or even that they're experiencing symptoms, they don't feel well, they may not be able to communicate that well, but so you have to be aware of and looking for other signs. So Dr. McGuire and Dr. Reed, do you have 2-3 steps that you think, kind of given all this, kind of challenges with our population, given that, what are 2 or 3 things that you think are most important for public health agencies to be doing to help respond to the COVID crisis, particularly in long-term care settings?
I'll start. This is Dr. McGuire. I think it's important for providers and all staff in long-term care facilities to be educated about the dementia process and recognize that when someone says no, or might throw what we would say in the South as a hissy fit about not wanting to do something, that we need to recognize it really may not be them trying to be mean or hostile. It really just might be the only way they can vocalize or express their thoughts or opinions about that. And I think it's important when I said all staff. This is also including, custodial staff, cleaning staff, because, they are interfacing. They may not be providing direct care, but I think they need to recognize and know the residents well enough that if they see some changes going on, that they can report that to their regular care providers. Dr. Reed, would you like to add anything else?
Yes, thank you, Dr. McGuire. The only thing I'll add to that is I think another important step is to stay abreast of new information and data that are coming out that CDC is posting and publishing. Things are evolving rapidly daily because this infection and virus. I think for long-term care facilities or healthcare facilities, staying abreast of how to best mitigate the spread with new information or updated information from CDC is a great step to help residents and patients.
And this is Dr. McGuire. So one place you can get that information is at cdc.gov/aging. There's a big yellow bar at the top, and it will take you to our website that has information regarding older adults related to the COVID response. I think it's also important to recognize that people who are working in long-term care settings right now, you truly are gems. It's 24-hour-a-day work. On a good day, it's a lot of work. But right now, especially with short staff and having to worry about the infection control and the PPE, you've always worried about infection control and taking good care of the people that are in your facilities. But right now we are being even more careful than we have before, because the implications for a facility getting an infection or several infections is absolutely terrible, as we know. So I want to commend you all for everything that you're doing, as well as dealing with loved ones who are caregivers like myself. The Miss French?
Yes, thank you so much, Dr. McGuire, Dr. Reed, for giving us some insights and input. John, looks like we have time for maybe just one or two questions that we've received from our participants.
Yeah, thank you so much, Molly, and thank you everyone for submitting your questions. Those that we don't have time to answer today, we will follow up on the dementia-specific ones after today's webinar. But Dr. Reed, I just wanted to put out one quick question. As we know, people living with dementia, there are health disparities that exist among this vulnerable population. Which of those health disparities should we be thinking about as we do plan these public health responses for residents in long-term care?
Thank you, John, for that question. It's a great question. There are health disparities, there are racial disparities, there are a number of disparities with this infection, but specifically, dementia-related health disparities have come in different shapes and sizes. What we should be thinking about are the different needs of people living with dementia in memory care units or wings versus those who live in community settings. Some of those differences include the rapid spread in long-term care facilities, as we've seen, and the allowance of visitors in those places, as opposed to people who live with dementia in community settings being exposed to possibly COVID-19 infection by one caregiver, especially if their caregivers are back at work. Alternate caregiving duties are not easy to come by in community settings, as it is in long-term care facilities. And those in long-term care facilities are at greater risk of increased exposure. As Dr. McGuire mentioned earlier, there are various staff members who provide varied levels of care and interaction, whereas those living in community settings might only be exposed to one caregiver. There are still risks on both ends. Finally, people living in low-income settings are more likely to have caregivers who have to report to work and may not have the essentials or the resources to have alternate home health resources as opposed to those who live in long-term care settings.
And then adding that complexity too to whether it's either a community care situation or a long-term care situation, people also are having to take care of their children, which does definitely a direct implication on the staff in long-term care facilities. Which has been, it's a real challenge for parents right now. What do you do with your kids if you have to go to work too? Big challenges. Or if the person you're providing care for is living with you as well too. Lots of complexities.
Absolutely. Thank you so much, Dr. Reed, Dr. McGuire. We are hearing more and more about how the COVID-19 pandemic is exacerbating some of those inequities that we've known about in public health for a long time. So directing attention to them at this time is a worthwhile endeavor. Molly, we had other questions come in, but I know we're tight on time, so I'll kick it back to you.
Okay. Thank you so much, John, and thank you so much to our participants. We, at the Alzheimer's Association, our public health team, we really strive for quality improvement. So please, just take 2 to 3 minutes, fill out our feedback form. And John, if you type that into the chat feature so everyone can click on it, I'd appreciate it. I will go through the resource slides that we have, but I will be sending them out to everyone later this afternoon. So I will go quickly, but you'll have a chance to actually look at them more in depth in a couple hours. I do want to thank Dr. McGuire and Dr. Reed for joining us. Thank you. We know your time is very valuable, and we greatly appreciate having your expertise on the call. Dr. McGuire mentioned, and so did Dr. Reed, that CDC has a lot and growing timely information guidance. For example, you'll see on the fourth one, their guidance for retirement communities and independent living facilities. It's always being updated, and at an easy to remember URL, cdc.gov/aging /COVID-19. Also information resources for public health agencies to be using with their communities. At the Alzheimer's Association, particularly for public health professionals, we encourage you to go to our website. We have, as you see on the side of your screen, some tip sheets that are on different settings and the public health response. It's also where you can go to access the Healthy Brain Initiative Roadmap. Very easy to remember, alz.org/public health-COVID-19. Hope you'll sign up for our newsletter, and you can learn more in general about Alzheimer's and other dementias from a public health perspective on our YouTube public health playlist. We do have, this is geared for EMS providers, but it's a customizable poster that is available on our website. Certainly with some communications tips to help anyone who comes into, is interacting with a person with dementia, with successfully communicating and working with them. That may be just a resource for you to use. And again, thank you so much for joining us. Just delighted to have everybody here. Please do take a couple minutes to do our feedback form in the next day or two. Thank you again. We will be following up with your questions and comments that relate to dementia in the next day or two and sending the recording next week. Thank you and have a good afternoon.